Welcome to Feeding the Family with Dr. Kristen, where we help you navigate the challenges of feeding your family and learn about the role food plays in our health and relationships. Feeding and food relationships can be stressful, confusing, and even destructive. I'm Kristen Saxena, a pediatrician and mother of 4 who's been researching and sharing what I've learned about feeding for over 10 years. In this podcast, I'll share my experience and expertise to help our kids and ourselves with everyday survival tips for real parents. This podcast is about progress, not perfection. So let's get started. Welcome back to Feeding the Family with Dr. Kristen. I'm your host, Kristen Saxena. On this episode, we're going to be talking about the 4th trimester and the importance of good health care for newborns and moms during that period. We're also going to be talking about adventures in breastfeeding and all that goes along with that. Joining me today is my sister-in-law, Dr. Sonalpatel. She is a neonatologist, pediatrician, and the founder of a newborn in-home health company called Naya Care. Welcome to the show, Sonal.
Hi, thank you. This is so much fun and exciting.
I'm excited too. So Sonal is my sister-in-law. So we go way back, like to my teenage years. I first met you. But you're the mom of 4 boys.
Yes.
Age 6 to almost 16 now.
Yes.
Yeah, you've got a driver on your hands. But also professionally pediatrician, neonatologist.
Yes.
You are a breastfeeding specialist and the founder, owner of a company that's called Naya Care, which provides home care for newborns, correct?
Yes.
Awesome. Well, can you tell us just a little bit about how you got to your company and really what inspired you to start Naya Care?
Oh my gosh. So you witnessed all my postpartum events, I guess
did.
I would say it. And I mean, I literally had everything. I've had a C-section to recovering from grade 3, grade 4 tears to preeclampsia to migraines. I mean, you name it, I've had it.
Not an easy road.
No, I was a really good pregnant woman. I looked cute. I could eat whatever I wanted, But the postpartum period really was, first of all, as a patient, I didn't realize that what little I was taught about it. Mm-hmm. As a physician, I didn't realize how many holes there were in postpartum care from the pediatrics and the OB aspect of it. And then combining that, it affected my work life too, because I remember after Rishi, I was diagnosed with postpartum depression, and you guys had come out, and my brother had mentioned around 2 months, you guys had come out, and my brother had mentioned, is like, you're not yourself. And I was just like, no, I'm fine. What do you mean I'm not myself? Look what I did. Look what I accomplished, right? And then, but when I went back to work, I went as an intermittent, which meant that I only went to work when I was supposed to, and I had to push myself. And so that lasted about 8 months. And then finally someone was like, no, you have postpartum depression. And the validity of that was just like, wow. Okay, thank you for recognizing what I thought I was having. And now that you had labeled it, it was easier for me to recover from it. You know?
Mm-hmm. Yeah, well, I think it's so hard because everything feels weird. So it's hard to know, is this normal? Is this how I'm supposed to feel?
Yeah.
Yeah, totally.
And then I saw it from the NICU standpoint, where we were so focused on taking care of this baby, and then all of a sudden, 2 weeks to 2 months out, you're handing this baby to a mom or a family. And what we had started to do in the NICU is around 2 weeks, we had started doing family conferences as like a mandatory thing. If your baby was going to be staying there longer than X amount of time, we're going to do a conference. And that involved the social worker too. And so much anxiety, postpartum depression was unearthed through that. And I was like, wait a minute, what are we doing? Mm-hmm. We're so hyper-focused on the baby. And when the baby's ready, we're sending him to a family that's not ready for the baby to be there. Right?
Yeah, and those babies usually, are even higher maintenance than your average baby, which I'd say is very high maintenance.
You're right, exactly.
Yeah.
Exactly. And so it was just this everything combined. Long story short, my 4th one, I did everything what my medical system wanted me to do, had my baby. 2 days later, went to my baby's appointment, came back, and it was so funny. My contractor, because, why not? Let's put all that in there. He looked at me and he goes, didn't you just have a baby? And he was the first person that I felt after my fourth, recognized the fact that I had that baby. You know, like I went through that process, and that just ignited us. And Nimesh, my husband, was just like, well, I was like, we were talking that night. I was like, I just needed a weight check. That's all I needed. Like, I needed this baby to have a weight check. Like, who can just come to the house? I will pay for someone to just come to the house to do this. And there's no one around Denver. And so then our company started with the home health, and it's a home health company supporting now, which is labeled the fourth trimester.
So tell me a little bit about what you guys do, what services you provide.
So we do almost the gambit. We do prenatal classes if you guys want them, but usually prenatally, we do a really good job in the medical field and our society to support moms, right? Like we shower them with everything.
Yeah.
So usually our prenatal classes aren't that much utilized, which is totally fine. And then postnatally, so our families will contact us about a month or two before they're having the baby. Then then they go through this whole system, they'll get our emails, they'll get introduced to all of us that are on that create the postpartum journey. So then at 2 to 3 days, we'll come out and do the whole newborn medical exam. But on top of that, so those appointments are 60 minutes, which is unconventional from the pediatric clinical appointments, which are like 15 to 20 minutes.
Yeah.
So we do breastfeeding education. We'll do lactation in there too. We'll do obviously the medical newborn exam, all the questions and answers. And it's really nice because now the dads are there, the families are there. Sometimes I've had grandparents there asking questions. Sometimes there's usually my last one, I had a 2-year-old. And so he was helping me out, doing the exams and just getting involved. So you're coming into their space instead of having them come to your space. And recently, ACOG has recommended that blood pressures need to be checked on women. And I've diagnosed one just recently, this last one I did. She had postpartum preeclampsia because we're starting to do blood pressures now as well.
That's great.
And so then you just get plugged into their OBs. It's like, no, you've got to go check your OBs out. And then the one that I had back in Labor Day, she actually had a vestibular arterial dissection.
Oh, geez.
Yeah, and because of the blood pressure check. She was complaining about stuff, and that was a whole story in itself, and now she's on stroke watch. So every time I feel that, like, why am I doing this? I walk into a situation and it's like, this is why I'm doing it. So that's our first, so all our appointments, and then we support moms, or we'll do the newborn appointments, the 2 to 3 days, around the 2 weeks, and then around the 1 month, so 5 to 6 weeks. So this allows babies to be home up to 2 months, and then they get plugged into their medical home, meaning they're long-term pediatricians.
Yeah.
And then on top of that, I've had babies who've had in-home phototherapy. And why I think it works for us is because the literature doesn't kind of support in-home phototherapy, but we're not telling the baby to get off the blanket. We're not saying you get off the blanket, come to the clinic, we'll get there, and now you lost about 4 hours of phototherapy.
Yeah.
We're coming to them, and then most importantly, we're doing the breastfeeding education because most of these babies are not getting enough food for whatever reason.
That's part of the jaundice.
Yeah,
Sure.
exactly. And so we're kind of doing that. So I've prevented, we've served 300 families. I've prevented 3 of them not to go into the hospital because of this kind of care. One actually ended up going to the hospital and ended up having congenital respiratory issues. And so they have to go into their whole path for that.
Sure.
And then lastly, I know it's actually a very comprehensive plan that we have kind of created. Then you get a mommy check-in, so you're screened around 1 month. And on top of that, like I'm seeing these kids or these moms, so I kind of screen them inadvertently too.
Yeah.
But there's an official mommy check-in, and then we have pelvic physical therapy around 6 weeks as a consultation, or as you get 1 hour with our pelvic physical therapist. So really the only part that I can't do is check your C-section because I don't feel like I'm qualified to do that.
Outside of your scope a little bit.
Exactly.
Yeah.
But we really want to make sure that we are really supporting this mom. And why that is so important is because they're like, why, as a pediatrician, do you care so much about the mom? But the literature shows if the foundation of that family is good, there's so many good outcomes with that child.
Totally. Well, I felt like with everything, especially in that newborn part, there's so many things like with a new baby that you're anxious about. And I've always felt like, the best thing for that baby is to have a happy, healthy mom.
Yeah.
Despite whether you're, what other things you're doing, whether you're breastfeeding or bottle feeding or,
Yes,
you know,
or
whatever you're
formula or
choosing and
whatever.
all the things that you worry about.
Yes.
And really it's like, if mom is happy and taking care of herself a little bit, that's probably the best thing that ever could happen for that baby.
Right.
So I think that that's incredible. I love that you're just really taking that holistic view. And I really also like, I think this idea in terms of the home care for two things, like you said, it seems anymore, unfortunately, sort of the medical system, we're sort of left in a place where doctors, unfortunately, in a day don't have, you know, time. There's not hour-long appointments generally for our newborns and our moms. And that's just not the way that it's built now. So you really don't have that time to kind of get into the weeds with all of the things that are going on. And I think even with COVID, I think we've all learned to sort of preference these things, like what can come to me? What do I not have to leave the house for? Yeah. And I also have 3 winter babies. It's always difficult, but I feel like in the winter it's even more hard. And the process of getting out of the house with a newborn, and gosh, you're probably still wearing diapers at some point for some of those.
Yes, it's like
you know what I mean?
Diapers
It's like,
and babies in diapers.
oh my gosh. And it's like, I got to feed the baby and pump and get myself all together and try to get, and then, you know, we're all like, feel like we need to be presentable. So like it's hours of work to just get you there for this 15 minute way the baby be told everything's fine and see you later. Yeah. So
I totally agree with you.
So beneficial. Yeah.
I don't think it's the doctor's fault at all. I think it's our medical system that has kind of geared it towards this, and then you unearth issues like, you know, in the first week you're like, oh, you're not breastfeeding well, so go to lactation. Well, that's another appointment. Or come back to me because I'm kind of good at this. Yeah, it's another appointment.
It is. It's hard, and it's like you said, that's that much time that you can't be feeding the baby. Yeah. It's all the time it took us to get ready and travel over here and get in here. So absolutely, I think it's really awesome. And you know, even though it's maybe what worked best for the system, it isn't necessarily what was working best for mom and baby.
Right.
And you also have a new book out about this topic, right? Can you tell us a little bit about that? I think that's so exciting.
I think so too. Oh my God. I think it was such a cathartic kind of journey writing it, because it started 9 months after COVID. And what happened during COVID was, like you said, people started realizing that care could come home. And so I got super busy, and it was very fortunate for me.
It's one of those silver linings. Yes. I always keep looking for these COVID silver linings. So.
Yes. So you got the word out a little bit more that this kind of care exists. And then I realized, I was like, well, so the vision is, I know it's to literally change our healthcare system. It's a huge vision. It's to standardize home health services and home health postnatal visits. So writing the book, I was like, okay, well, how am I going to make this interesting? So my teenager, he just read it, and he actually said, Mom, that was really well written and engaging, which is a lot coming from a teenager, which I had to make him read about postnatal care and our healthcare system.
So maybe outside of his usual interests.
Exactly. So it was like, and then, you know, when you write a book, you're supposed to talk to one person. And so my friend Rajiv, when I had mentioned him, I was writing this book, so male physician. And I want to prefix that because it's really to make, so when Nimesh understood what I was going through, he helped. Yes. Yeah. He was just like, no, go build this, right? Like, go do what you need to do to build this. So the point of the book is to reach out to healthcare providers, policymakers, the birthing community. But you also need, like, as women, we totally understand. Like, I tell you this postpartum period is hard. You're like, of course it's hard, right?
For sure.
But then for our counterpart gender to understand exactly why this is so important. So Rajiv came, and I was like, oh, Rajiv, I'm writing this book. And he was just like, you know, that's great. But so the book evolves around addressing maternal mortality and how postpartum visits help with that number. And he said to me, is like, Sonal, you know, a lot more women die from like heart disease and cancer and just at car accidents.
Right. Like, we don't think of that as a modern day problem in the United States.
Yes. So why are 754 moms, because that's what the rate is right now, why is that so important? And then it kind of hit me. It's like, oh, I've got to explain to you why, like, global and federal and state initiatives are created around maternal mortality and the role of postpartum care and postpartum home visits in that. So that's the main point of the book. It's to realize that. The book is called The Doctor in Her Black Bag, and it highlights how I got to this journey. It highlights 10 patients that took postpartum care, like our model of care, while they were in COVID. So all these families had babies in COVID. It's a gambit of moms who, one mom, her husband had hernia surgery, like literally a month before she had her baby in COVID.
Oh my gosh. And isn't that always the way it goes? I always feel like I would get all these families and they would be like, oh, we just had twins in the midst of redoing our kitchen. And also he took a new job. And it's like, I don't know. But that's life, right? There's always 8 million things going on.
Yes. One mom and their family, unfortunately, were told that their baby had tetralogy of Fallot like literally 6 hours after the baby was born, again in COVID, and to kind of navigate the healthcare system when your baby needs heart surgery. And then one dad, so we have one dad in there, and he is he's a self-identified gay dad, and his sister lost custody of their nephew because of her situations. I mean, she was into drugs, and he's very open about it on it, everything. And all of a sudden, he's a dad. You know? Like he says
most of us have a few months to at least prepare.
He had 2 weeks, and unfortunately, Skylar, his son, was in the NICU.
Oh my gosh, that's a lot.
So it highlights that, and then it goes into the historical aspect, like how do we get here? Like what happened in U.S. history in this area that we got to the postpartum care we are, and then the solution for it. So hopefully it's a good read.
Yeah, I think it's just such a cool topic and something, I think everyone, like you said, the idea is to really be able to change policy, but in order to do that, we need to educate ourselves, because I think it's something we just sort of take for granted. Like that's the way it's always been, not really, but in our lives, that's the way it's kind of always been. And so I think for a lot of us, we don't think about like the system should be different. We just kind of think about like, why is it so hard for me in the system? You know? So I think that's really cool.
Yeah.
Really cool.
Super excited about it. So it's out. I'm excited.
That's amazing. So everyone should check that out. The Doctor in Her Black Bag.
Yes.
And best way to get it on Amazon.
And Amazon.
Okay.
Yep.
Look her up.
Yeah.
So another thing I really wanted you to talk about, or the reason we really had you here, was to talk about breastfeeding.
Oh my goodness, yes.
So you are a breastfeeding specialist, and you, through your home care and really through your other clinical practice, have helped a lot of families with breastfeeding. But what I wanted to start a little bit was for you to talk about your own experience with breastfeeding your kids.
So Sahil I had in residency.
He's your current almost 16-year-old. Yeah.
Yes. And I had a C-section with him. And, it was at that point, this was in 2004, 2005. There wasn't a lot of breastfeeding education out there. I still remember in being a third-year resident on my OB, and the OB saying, hey, to the mom, hey, do you want to breastfeed? She's like, no, okay, well, why don't we bind it? And that was it. That was the extent of discussion around breastfeeding. And so I came into my own breastfeeding journey at that point with a little lack of education. We had this amazing attending down in New Orleans, and she was wonderful, and she was pushing it. But at that point, it was just a minority, right? Like in our medical education, we don't get a lot of benefits of breastfeeding. So, his was a C-section. 9 weeks later, I'm back onto 80-hour work week. I'm trying to pump. I'm trying to do all of this, trying to take care of being a resident and all of that. And it was a complete disaster. It was like it's not
if there are any residents or whatever, I do feel you, because I had my first in residency too, which I think goes back to that story of everyone seems to have a baby amidst like a kitchen remodel or working 80 hours a week or whatever. But I guess there's never a good time to have a baby.
Not in medicine.
So I think not in medicine, but probably not in anyone's life. But for sure. So shout out to all the resident moms, because
oh my God, yes.
Geez.
So, seriously,
we feel you.
I know. I had two upper levels at that time. That one of them had a baby first year of pediatric training and third year, and she breastfed. And I was like, this is incredible. So I thought I could do it, but
Yeah.
obviously it was a total disaster.
Yeah.
And then, Sahil ended up having a lot of allergy issues and atopy and just, and I just kind of started blaming myself that if I maybe, because breastfeeding can help with that. And if I could have done a little bit of better job, maybe he wouldn't have had the eczema or he wouldn't have had the asthma, and all of that stuff. So again, blaming mom guilt,
Yeah.
blaming myself. So educated myself.
Even though that runs in your family.
Of course.
So we should throw that out there too. But of course you focus on I'm sure this is my fault.
Exactly. Because
Yeah.
I didn't provide the breast milk.
Right.
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 I didn't do
Mom
it.
fail.
Yeah, exactly. Total hashtag mom fail. Then with Rishi, I got better educated and we were able to do it for 6 months exclusively. So which was whoa, this is awesome. I'm able to do this. And then with Rithik, it was kind of the same. And then at 9 months, I noticed both with Rishi and Rithik.
2 and 3.
2 and 3, yeah. My body was just kind of giving up. And then I went, and especially with Rithik, I had a lot of postpartum anxiety. And I didn't know that at that point. And I mean, I was doing the mother's milk. I was doing low dose Reglan, anything.
Oh, the tea stuff?
The tea.
Yeah, we should talk about that too.
Yeah. Fenugreek, anything that could help boost my supply. Literally, and then I'm back into the NICU. I'm doing rounding and all of that stuff. It was hard. I'm talking to my lactation people there to be hey, how can I do it? I'm power pumping in the middle of rounding and what am I doing to myself? Then I realized with Avi that, I'm just going to do it.
Number 4.
I'm just going to do what I want to do. And what I started noticing with him is that, and the other boys did it too, and I just didn't take the time to acknowledge it or even just recognize it, was when he got introduced to food, he was just oh my God, what a different world. I don't want to be attached to a boob, Yeah. He was just boom, I'm out of here. And he would nurse really well at night. Not to say that he would wake me up at night once in a while, but that's kind of normal. But we would have our good nursing sessions when I came home and in the morning before I went to work. And if I was off during the day, we would give a little bit here and there of formula.
Sure.
And I realized, oh my God. And so with him, I lasted 15 months doing that routine because I allowed my body to do what it was supposed to. And I kind of listened to my body. And then I was wait a minute. My body was telling me this. It wanted to do this. It was actually really going with what my kids were doing. And I had this preconceived notion that I have to give them milk for a year.
Right. Well, that's the recommendation.
Yes.
And I'm a pediatrician,
and
or
so,
I want to be a good mom. I mean, period. And you're well, then I'm going to do what I'm supposed to do.
Exactly.
Yeah, totally.
And then it was at that point I was just you know what? This is how we're going to do it. And so with the combination of formula, breastfeeding, and, I gave him breast milk till 15 months. And yeah, it wasn't exclusive, but good God, that boy got every single drop of that breast milk because that's what he wanted.
Yeah.
And so I listened to him rather than me.
Well, and I think that that's such a good point too, is that back in the day, way back in the day, there was no formula, right? No. And so theoretically, humans should be able to survive. And I'm not against, we use formula. I'm all for formula. Formula is an amazing discovery and an amazing part of lives, for sure. But I think that what was also missing was these ideas about what you were supposed to do and these strict guidelines. And so, because for me too, with breastfeeding, I breastfed all the kids some. They all got some formula, except Sean, number 2. But that was because he would barf it out every time. He just didn't like the taste. It was very stressful for me. So that's beside the point. But I think that was the thing, is that I always say I wasn't very good at that. And I don't mean that to be self-bashing. It's just you have these people that can produce deep freezers full of milk.
Yeah.
And I was yeah, that's not me. And I had big hungry babies, and I'm very good at gestating big healthy babies. I'm not that good at feeding these big fat babies that want to eat all the time. So, I thought the same thing, and I've told this story before, but when my first was born, and you're a pediatrician, you're going to come from the gates and you're going to do everything right. And it was a disaster. He was hungry all the time. I was so exhausted. I wasn't confident that he was getting enough to eat. I mean, I was feeding him, I felt like every 10 minutes. My nipples are just bleeding.
Yeah.
Like I was at my wit's end. And like,
you don't feel good.
Oh, I felt awful. I was like constantly anxious, you know. And at one point I remember he woke up and I was legitimately, I mean, my boobs were so sore. I was so tired and I was legitimately afraid of my baby. I remember like waking up and being like, the feeling I have is fear of this baby. Like that's not a healthy place. And thankfully my husband convinced me. He's like, can I just give him a bottle, some formula? And I was like, fought it for so long. And like just that relief. Like if we should not be creating scenarios where a mom is afraid
of her child,
of her baby. Yeah. You know, when you're a grown person, you're afraid of an 8-pound, like can't stand entity. Like this is a problem. So I think that that's just, you know, I think it's just such a balance that we have to have, especially in the medical field or where you're assisting people with breastfeeding. You want to be able to encourage them and support them to do what they want to do. But also, I think that I experience that sometimes if you get some of the people I think in the breastfeeding community are so gung-ho about it that it gives you this sense of like kind of guilt or shame if you're going to give your baby some formula or exclusively formula. And to me that was huge in just like the anxiety relief. And I think that was it. And the later, you know, once I realized I did that and my baby survived and even thrived, then I was able to give myself so much more permission to just be like, well, we're just going to see how this goes. Right. Like I know that this is something I want to do. I know it's good for them. It's good for me. And some is better than none. Yes. And my first baby, he turned out pretty great. And he had all kinds of formula. Yeah. So I don't have to worry I'm like ruining my babies, you know, by doing that. And so I think that the messaging and just like realizing what moms are going through and the permission to be like, this is not a fail. This is actually, like, for me, made, I think, my later breastfeeding experiences more successful. Right. Because you were like, oh, okay, well, I can just calm down a little bit and just do what I can do. And whatever doesn't work out, it's going to be fine. Because we live in this wonderful day and age where you know, there is formula. Your baby's not going to starve to death.
There's a lot that you have just kind of highlighted. So I'm just going to kind of take it one at a time. So first of all, if you actually look at breastfeeding history, it is postulated that the ancient civilization domesticated animals that we know, cows and sheep and goats, for their milk. Yeah. Okay, so that's one. Number two, historically, all women are not able to produce breast milk. Why? That's Darwinism. That's natural selection. Like let's really look at it from that kind of perspective. Then we have wet nurses not only in history, like our narratives and stuff like that, but also highlighted. I mean, the royals back then, I mean, it was shunned not to breastfeed. So they had wet nurses. Yeah. Right? Like the queens were not supposed to breastfeed. Like we have wet nurse.
Well, they had to get up and queen. That would have been hard.
Exactly. Like I gotta look all pretty. And then again, we have milk sharing. And so milk sharing is like, I kind of explain it like, you know, if your child is struggling and we're kind of related, we just switch babies because what happens, let's say my baby is a newborn, your baby's a 6-month-old, your body's already used to making that milk. My body's starting to learn. And so we switch babies because now the newborn gets the milk. And then the 6-month-old can help me kind of just rev up my system because he knows or she knows how to do it. What we call here is called donor milk. You know, that's what we related it to. So that's the history of breastfeeding. And we don't talk about that much, you know? No, we don't. The guidelines that came up from the WHO, the WHO organization, to breastfeed for 2 years was actually for birth spacing because breastfeeding, you know, you're not, your whole prolactin and all of that is suppressing.
You're less likely to get pregnant.
Right. Yeah. So to support maternal mortality, right? Again, how they support it. So they came out with the guidelines for 2 years because then the woman's body's able to recover to have another gestation.
Right. And I always assumed it was also related to just supplemental nutrition in areas of the world where it was more difficult to have enough food.
Right. But also the water issues there too. So formula sometimes cannot become the sole source because formula is great, but you have to have good water.
Right.
And you can't just you have to have that too. So that's where the WHO came up with that. Then the AAP adopted it for definitely 6 months exclusive and then a year. But then if you look at the data, if you look at the data, the CDC, if you look at it, we do a great job initiating. 80% of American women start breastfeeding. By the time you get to 6 months, it's down to 26%.
Sure.
Okay, just across the board. But if you allow that woman to have some degree of formula in there, your breastfeeding rates jump up to 50% of those women actually continuing to breastfeed.
I believe that.
You know?
I believe that. I mean, I think that sometimes it's that pressure on the exclusivity.
Yes.
That, at least to me, was that's a huge differentiator in terms of just your approach.
Yes.
And your mental state around it.
So we should change the narrative that we want you to breastfeed. This is something that's good for moms because you reduce ovarian cancer, heart risks, and all of that. You help with your post-pregnancy weight, which can lead to better health outcomes. It's documented for mom. It's obviously documented for babies. So let's start with the narrative. Okay, you want to breastfeed? Great. Here are all your choices. Here is all your choices. We're going to help you as a medical community in your journey. But we're not going to add another layer of anxiety for you. Because for me, I allowed formula to come into my life. I was able to breastfeed my child for 15 months.
Right.
You know?
Yeah.
So I think changing that narrative is so important. I always say that I'm not sure how breastfeeding became a gold standard of motherhood. If you breastfed, then you're like, oh my God, you're a good mom. Yeah. And you're like, how did that equate
well, you know what? If you're miserable, then I don't think those benefits, you know what I mean? I feel like that the benefits certainly do not outweigh an unhappy, strung out, anxious mom.
Yes.
For sure. Yeah. And I think that that's such a good point. I would love the idea, I think now approaching it to encourage moms to start with the idea of saying, so that this will be an option for you as you go along. Because that, I think if you've already decided from the get-go, and maybe that is right for you and you know it, and maybe, again, this is baby 4 and you're like, I hate breastfeeding, I ain't doing it.
Yeah.
Fine. You do you. Yeah. But I always think if it came with that idea is to say, we want to make sure that this is an option for you because you might find it something that works well for you and you love it to one degree or another, maybe exclusively, maybe a little bit, maybe not at all. But if you get started, because the beginning is so hard.
Yeah.
And so if you get past that hump, I think it becomes a lot easier, but it's hard to keep sight of that.
Yeah.
When you're in those initial days where things are struggling. Everyone's learning.
Well, that also, when we just talk about formula too, we don't do good education about formula. There's so many formulas out there. I mean, you've probably witnessed it. I've had a couple of babies that poor formula mixing has landed them in the ER and in my NICU. So we're not even talking good formula education, what's soy-based, what's not soy-based. Why does my baby need all of this instead of this? Right. What's the organic ones? There's a lot of European formulas coming into our system. And there's no good education about that either. So how can a mom be well-informed if she doesn't have all the education out there?
And I'm actually we're going to have another guest soon who we've had on the show before, Allison Ventura, who actually has done some research about responsive feeding with bottle feeding, which I think is something we really hardly ever.
Yes.
I mean, certainly as a pediatrician, I never really learned about that, and I don't think it's something we talk about. We talk about that more related to breastfeeding, but clearly we have so many moms and dads using formula as well. And so I love the idea of doing the research and talking about well, I mean, a lot of these same behaviors and all of these things are involved in bottle feeding. So let's talk about what's the best way to approach that. And I think you're left a little bit adrift.
Yes.
Because that messaging just really isn't out there.
Yes. No, totally. I mean, that's what's the thing. It's just we're saying no formula, breastfeed, but you're not educating in either one of them. No. So, I mean, I have moms come around to me back at 4 to 6 months and it's oh, you know what? My supplies dipping? What can I do? X, Y, and Z. And so the thing is, you're offering support then, and so you're encouraged to offer support then, right?
Yeah.
But it's that open dialogue that it should happen.
Totally.
And then last thing that you had mentioned about those moms that have like those tons of milks and stuff. And so I've had a couple of overproducers, and it's hard for them.
Right. That's
You
true.
know?
I would say, because when you're on the other end, you're a little jealous.
Yes.
Like, I'm a little like, a freezer full. If I had one bag I could freeze, I was like, look what I did.
But you know what? I didn't understand that until I had these patients that they were just like, it was constant for them. It was so tiring. It was one woman had such back issues because her breasts were just, she actually came in crying, and she was just like, could you please help me stop this? And, and I don't think that message goes out either.
That's true too. That's a very good point.
To be like, oh, it's really all those overproducers. Yeah, they might be like, hey, this is what I did. Yeah. Because they're like, do you know my journey to get here? Because
exactly. They're like, I have a freezer full because I need to get it out of me.
Exactly. Exactly.
Totally. That is an excellent point.
So it was just, I was actually very surprised to learn their journeys too. I have to be very open about that, because I was like so jealous of them. And I was like, I'm so sorry.
Like, that sounds unpleasant.
Yes.
So you help lots of moms along their breastfeeding, and you also talked a little bit about this, but like supplements, and there's lots of products you can buy to help with your milk supply. And I would be interested to see what your experience with yourself or your clients is. For me, I tried all the teas and whatever, fenugreek, all those things, and I really didn't see that it made any sort of difference. So, I got enough stuff going on. I quit drinking the disgusting tea and buying the expensive milk cookies. Maybe they work for somebody, but I was like, ugh, this is gross, and I don't need one more thing to do. But what's been your experience? So,
first of all, my message is the stress about breastfeeding kills breastfeeding.
So true.
That's just there, you know, like that anxiety about it. Secondly, look at your nutrition.
Yeah.
Like we drill it, that water, all that, but we don't drill the nutrition. So in the first week, just realize, okay, a C-section is abdominal surgery with a baby attached. That's what it is, right? So your body is trying to do two things. It's going to be in such deficit of trying to recover your own body for healing, and then you got to make milk for another human to survive. Right? Like that's a lot. That's a lot of calories. Yeah. Right? So when my moms come, I go, okay, what are you eating? Right. And literally 8 out of 10, they're like, so if I have a repeat client, they know, and they're like, no, doctor, I got this. But if I have a new client, they're like, oh, I had a granola bar. Okay, from like 8 to 12. Well, how many times did you breastfeed your baby? 3 times. Like granola bar, it's not going to suffice. Right. So really looking at their nutrition and making sure that they are getting the right nutrition and eating healthy. Okay. My experience is the same with yours. So usually that kind of takes care of it, because A, they forget about the stress about it. Then they're allowed to eat. Okay, so Target has this Archer Farms chocolate cake for any chocolate lover that's out there. It's one slice, 800 calories, okay? The only time I've eaten it is when I've been breastfeeding.
Like, I need 800 extra calories.
I need 800 calories.
I will get those in cake.
So giving them the permission to be like, you need to eat more.
Yeah.
And obviously
but I think that's it's hard for two reasons to me, at least my experience and just thinking. Like, it's kind of like you alluded to, like when you're pregnant, you're adorable. You've got this like tighter belly, and like, everything's great. And like for me, the day after Sonu was born, I never felt more disgusting in my life. I mean, it was just like, then all of a sudden you're just like kind of feeling bad about yourself. You're like, I used to be this cute pregnant person. Yes. And now I just feel like deflated and disgusting, and like I'm leaking everywhere and I'm just gross. So I think you have that part where you're like sensitive maybe about your weight. And so like part of you is like, maybe I shouldn't be eating chocolate cake. And then there's the other piece where you're just tired and exhausted and not having time, and maybe not prioritizing yourself. So it's like, I ate that granola bar because it was fast, and like the only time I had to
feed myself.
Feed yourself.
Yeah.
Yeah. So the tips that I have is if there's no nut allergy in the house, or you don't have like little tiny kids, to get one of those big trail mix jars, okay, or almonds or whatever you like to eat. Put it right when you're nursing, because even so, you nurse about 8 to 12 times in the first week. Let's just put it that way. I just want you to eat four almonds, for this, for that. That's all I want you to eat, because guess what? In a 24-hour period, that's 40 almonds that you've just eaten, and boom, unknowingly you've kind of upped your nutritional intake. And then when I come back, they're like, oh, we got that. And then so here's the deal too. The home visits allow me to talk to more of the family as well, right? So then they come back, they're like, well, we got all this stuff here. And the dads are like, yeah, I'm just in charge of feeding her because she's feeding my baby.
Yeah. And
then it becomes a unit. So lately what I've seen with the dads getting more education, it's they view as breastfeeding, because dads kind of feel left out of it.
Yeah.
So 2 of my dads have actually told me this process is our family process. So I'm in charge of this, and this, meaning I have to feed baby. I'm feeding the mom. I'm in charge of the meals, and they are looking upon it as this breastfeeding is just not my wife's responsibility, but is my responsibility, because hey, guess what? At the end of the day, I'm saving money because I don't have to buy formula.
Right.
Like, sorry, just get to the heart of men are very objective.
Saving money is always good. And formula is very expensive.
Yeah, but they're very objective. Men are very objective. It's like, tell them what to do exactly. They will do it, and they'll do it wholeheartedly.
Well, and I think that's such a good point too, is I think that was one of the best parts about some bottle feeding was being able to involve dads and partners in that, because I think it is something where they kind of get left out in exclusive breastfeeding. It's like, oh, but you can change the diapers. Oh, yay, thanks. That's the funnest part of having a baby, right? So I think that, but that other idea where they feel like, oh, I can, when they realize that you need help taking care of you, I think that's very empowering also to partners.
But it was so beautiful to see. I had to see that. Like when they were there, like the minute that the mom was breastfeeding in both situations, the dads were right there, the water, the food. And I was like, oh, and they're like, no, this is my responsibility as well. Breastfeeding is my responsibility as well, is what they articulated. And I thought that change of narrative was so amazing. That it's very cool. Just not the mom.
Very cool.
Yes. So again, going back to all those herbals, fenugreek caused me gas, caused my baby gas.
Right.
So I'm always just mindful to be like, okay, stop stressing. You're killing your breastfeeding that way. Good nutrition. Really, please, let's look at it to make sure that you're filling up your tank in order to fill up someone else's tank type of deal. Kind of really quick and easy ways to do it. The other quick tip is put a water bottle in the bathroom, because the first week, that's all you're doing, right? You're going back and forth. So make it accessible to where you are. That granola bar, sure, eat it, okay? Don't kind of think for it, but getting your whole family involved and feeding you as well.
Yeah.
That's important. The lactation cookies, brewer's yeast is what's in them. So you can actually take any.
That's what my grandma always said. She drank beer every day.
Yes, it is.
That was her tip. That's not my tip necessarily.
So,
but that was my 100-year-old grandma. She's like, I just had a beer every day. And she's like, I fed those babies no problem. I was like, I like your style.
Yeah. So alcohol and breastfeeding. So let's kind of talk about that, because actually your grandma is right. So brewer's yeast is in beer. So the darker the beer, so the actual thing is Guinness will increase it, because it's a really thick,
I can't do the Guinness
beer.
It's like a beer milkshake.
It is a beer milkshake, but
Stimulate.
So when families ask me about it, so then we lead into alcohol. If you can find your baby, you can feed your baby. That literally is the new recommendation.
That's actually one of our questions later. So we'll revisit this, but.
So that's
we'll put that as Dr. Sonalpatel.
Quote. You can feed your baby. And that's what it is brewer's yeast. So brewer's yeast is a yeast nutrition. And you can put it on salads, pasta, like, don't complicate things. Like, and then in any cookie, you don't have to buy the lactation cookie. So for example, I had a family who was mom and the daughter was 3, and over the weekend they made protein balls with brewer's yeast in it, and then they made lactation cookies. And there you go, mom guilt, right? Because now you have another child and you're like, oh my God, I can't spend time with theirs. So it's like, well, why do we have to separate this family? Like, why does mom have to feel content if she's only coloring with her 3-year-old? Why don't we make no bake protein balls with the 3-year-old? Now you're accomplishing so much, and those protein balls are good for the 3-year-olds too. Right. So instead of kind of piecemealing this period, let's kind of figure out how we can do it together as a family.
I like that. And I totally agree with you. I think just the bottom line being like, hydrate, feed yourself well. And my belief is really that kind of those products that are marketed hit us all at a very sensitive time where we're kind of desperate and like feeling like I need this and I need to buy this and this. My experience has been, and I would think that the research really doesn't show that any just supplements like that are substantially improving anyone's breast milk. So I mean, if you want to do it, fine. But I would say a focus on just hydration, rest as much as you can, and just eating yourself is going to pay leaps and bounds above anything you're going to
listen to your body.
Find.
I mean, my body at 9 months was like, dude, peace out. Your child's eating.
I'd be like, I'm cool. For sure.
Right?
Yes. So do you have does any like crazy breastfeeding story of your own come to mind when you reflect on your breastfeeding? Do you have any? I feel like most moms have like some moment where it was just like a disaster or something hilarious.
Oh my God. Okay, so something hilarious. I remember flying with, I think it was Sile. It was my first one. And he was about 8-9 months old, something like that. And we were flying, and he just was like, his schedule was so off, right?
Yeah.
Like just totally off. And he's like screaming, we're about to take off, and he's screaming, and blah, blah. And my husband, Mesh, he goes, pull the boob out.
That was just to distract the other travelers, actually, that were staring at you with the baby. You're like,
and it was so funny because like Nimesh had recognized that like that was something that was comforting for our child.
Totally. Oh, that's what I did on flights the whole time.
It was like, pull the boob out.
Stick them on the boob.
Just like, wait, what do you want me to do? So I think that's like the hilarious part of it.
I love that. Yeah. I was thinking about this, and when I think back to like breastfeeding, like I said, every mom I talk to has some sort of like list of like ridiculous activities that ensued related to breastfeeding. But I remember Leah, so my youngest, she actually had a tongue tie.
Yeah.
And she had this little like heart-shaped tongue. And one of the things that can happen when you have a baby that has tongue ties is the latch is less than ideal. And I, for whatever reason, already have problems with like bloody cracked nipples. So tongue-tied baby and me, it was ugly.
Right.
I was ugly. So it was before she had got it repaired, I think. So we ended up taking her in to get it clipped pretty early on. And so I had very bloody nipples, but we were still breastfeeding. And it was actually going pretty well otherwise. And my brother had come, into town to visit our new baby, and he's holding the baby. And she spits up like babies do. Only she spits up just what appears to be just like copious amounts of blood. And my brother looks at me like, your baby's dying. Like he's holding this baby. Right? He's got bloody breast milk all over him. And he's like, your baby's dying.
Yeah. Right.
And I'm like, oh, don't worry. That's my blood from my nipples. And I think he was more horrified. He was like, I've got your nipple blood all over my shirt. So I'll it was like Carrie, he had just this blood all over him. And I think that's the difference though between first and fourth babies. And you're like, no big deal. Normal. That's just my nipple blood all over your shirt. So anyways, thanks so much for joining us. This has been super fun. I think great conversations. And I think the biggest takeaway from you that I love is this idea of taking care of baby and taking care of mom. This is the same thing. This is all one and the same.
Yes.
I love it.
Yes.
So I'm going to move on to our next section.
Sure.
Ask Me Anything. We have a couple of questions. The first one, that you kind of alluded to a little bit is from Tammy. So what is the role of mom's diet or changing mom's diet for helping gassy, fussy babies?
Okay, so here's the thing. So it depends where the baby's at. So around, I mean, I don't know who designed us because this kind of sucks.
Right?
But the first 2 weeks, you shouldn't encounter that much. But what's happening is babies' guts are developing as well. Okay. So when their guts are developing, that occurs around, they start showing signs between 3 weeks, as early as 3 weeks. And we used to call it colic before because colic meant that something had to be fixed. Like you gave gas drops to get it fixed, right? Now it's called the purple cry syndrome. Google it, look it up. There's great research on it for families to understand that this is actually a developmental phase that all babies go through around 3 to 6 weeks, and it gets better around 2 months. But in that phase, it can feel like colic and can feel very overwhelming. So first of all, educate yourself in the sense that where is my baby at? Is this my baby is around 6 weeks? Look up purple cry syndrome. Do they actually fit the criteria for it? Then there's this understanding that, okay, this is a developmental phase. So then again, I don't have to go into anxiety provoking stuff to be like, okay, now I have to get which I have to eliminate all these things in my diet.
Yeah.
I have to go get the best colic drops for that purpose.
Right.
So that's number one. Number two, yes, there are medical issues that do come up that, go see your pediatrician and figure it out because they're going to be the best people to help you because they know your baby the best that way. And then with eliminating, anecdotally, I've had moms eliminate cow and soy and all those kind of products and it's helped. But here's the deal. It takes about 2 weeks to get it out of your system.
Yeah.
So now...
And by that time, have they just
changed?
They've grown out of it.
Changed. So one thing that I think has kind of helped in the transition are probiotics to start them early. Gerber actually makes one with vitamin D and probiotics together. So if you can start on probiotics for the baby earlier on, that's one thing that I've noticed that's helped with it.
I like that. Yeah, I love this topic. And I mean, it obviously does vary baby to baby. And there certainly are babies that have real issues with some things in their diet. But I do think it is overemphasized or overdiagnosed. And we end up with moms, again, who are already struggling to feed and take care of themselves. And now have been put on an elimination diet where they're like, you can't eat all these,
but
soy
it takes 2 weeks
and
to get
dairy
out of
and all
your
this.
system.
Exactly.
So it's just like, well, what happened first? Did did your baby just grow out of it?
And there was all this, I think people would always think like if you ate things like cruciferous vegetables that people would say, well, that causes gas. Well, although food, like nutrients from the food that you eat and particles of the food you eat are going into your breast milk, whole pieces of broccoli are not going, you know what I mean? And so I always and anytime your baby, at least I've had this experience too, anytime your baby was like gassy or whatever and you're breastfeeding, people always go, what did you eat?
Yes.
And I was like, I don't know. Babies just fart. Like, leave me alone.
I mean, their guts are developing.
Right. Exactly. That's part of the process.
So like with the fenugreek I'd mentioned, I mean, my, at that time he was 3 to 4 months and I was like, oh, okay, that's a fenugreek, because I had a better understanding of where my baby was developmentally.
Yeah. And I mean, if you notice something like every time I eat this, my baby has issues, fine. But for the most part, like I said, follow with your pediatrician for sure. But if your baby is otherwise normal,
healthy and normal,
growing
and
well, then I would be reluctant. I would think twice about suggesting elimination diets for people because it's really hard as the mom.
Yeah.
You're already struggling. And things like soy, the things they suggest, that's in
Everything.
all those granola bars, all those things. So it's legit difficult.
Yes.
So
I mean, and there are some moms who have really benefited from it, and they've noticed that if they reintroduced it, yes, but just don't overkill yourself. Kind of figure out where you are. So
totally.
Yeah.
All right. My second question you also discussed earlier is from Karen. She said, what's the deal with drinking and breastfeeding? Do I always need to pump and dump?
So no, again, those recommendations have gone out the door, so you don't have to invest in any of the, alcohol strips or anything like that to figure it out. So really, honestly, if you are not feeling, so let's say you had a drink, okay, and when it's time to breastfeed and you're not feeling anything, totally fine to breastfeed.
Yeah.
Okay. Let's say you went to a bachelor party. I had a mom who went to a bachelor party. She goes, do I have to dump everything out? Well, if you're heavily intoxicated and you feel like you need to pump and you're pumping at that time, that breast milk's not really good at that time,
Yeah, if you're like passing out while
and somebody's pumping for you. I don't know about that.
Well, if your friend's holding the pumps, then maybe.
Maybe not. But after that, like let's say you had a good night at party and you went to a wedding and stuff like that, and then in the morning you wake up and you're engorged, but you're feeling fine. Well, that milk is fine. So it's whatever you're feeling. It's your liver that is kind of detoxing all of it. And so now they're like literally the recommendations are find your baby, feed your baby.
Yeah, I like that. I think that was one of the like lactation people I had worked with. She had said that. She's like, if you're not drunk, then you can feed your baby.
Yeah.
But I think that, it is worth saying that like alcohol, some portion of alcohol does like come out through the breast milk. And I don't think anyone knows exactly, like there's never been any hard
there's alcohol in cough medicine.
Well, that's true too. That is true too. I think delaying, one of the best times might be actually while you're drinking.
Yeah.
So if you're going to have a glass of wine, maybe nurse while you're drinking the glass. And then, but otherwise I think, if you're really worried about it, then I used to tell people like a couple hours after, if you have a drink, a couple hours after, that really should be.
It should be fine.
Pretty much out of your system.
If you're not feeling it, it's not in your breast milk. Yeah. Literally. That's it.
Yeah.
So don't complicate it.
So the pumping and dumping, I think that wasn't when I had the kids. I remember doing that because I think there was more, there wasn't as much information about it. And so, but I don't know. I think that's another one of those things where, if you're going to be intoxicated, someone else should be taking care of your baby.
Exactly.
That's maybe the takeaway.
Exactly. But
I love
you know what? Honestly, you don't drink in pregnancy. Like a half a glass of wine makes you woozy. You know what I'm saying?
That's true.
Like you're not going to be out there, but there's some scenarios like weddings and bachelorette parties, and like talk to you. And the American Board of Medicine is a really good resource as well. So Academy of Breastfeeding Medicine is their thing. But
that's what I usually say, just to. I would usually, if I have a drink, wait like a couple hours to nurse if you're worried. Yeah. If you want to be extra cautious.
Yeah. But again, like you had your baby, you're fine.
Perfect. I love it. Well, thank you so much for joining us, Sonal. This has been an absolute pleasure.
Yes. It's so much fun. And congrats.
Oh, thank you. And thanks for joining us for another episode of Feeding the Family. Be sure and hit that subscribe button so you never miss an episode, and we'll see you next week.